Okay, can you state your name and where you're from?
Hi, my name is Carolina and I'm from Colombia.
Thank you for interviewing with me for my cultural presentation.
No problem. It's my pleasure.
So, in for my project, I am trying to elaborate on what the Hispanic population thinks is respectful communication. And some of the things that I found were that the Hispanic culture prefers that people start with small talk before getting down to the main topic during their healthcare appointments.
That sounds about right. It's just easier to get into a conversation with somebody you don't know if you make a small compliment or just, talk a little bit about how the day is going. You don't have to be extensive. And instead of just going and checking off the list, it's just better to make it conversational instead of somebody asking me if I brushed my teeth today, how many pills I took, and what are my past medical history, instead of just saying, hi, what is your daily routine? What do you do in the morning? So what is your hygiene like? Instead of just being so structural.
Mm-hmm. Do you think that making eye contact is respectful?
I mean, for Hispanics, it is. I heard in other cultures, people don't really like it because that means that you're trying to court them or trying to be more personal with them. But for Hispanics, I think eye culture is a big thing because if you don't see somebody that is looking at you, you may not trust them the same.
Mm-hmm. I see. Do you think that it's important for the Hispanic culture to know that the provider that they are communicating with is familiar with their culture?
Oh, I think that is the most important thing. And, it doesn't only go to Hispanic, but to all cultures. But it's important that if you know that your culture doesn't eat certain things or love certain things, it just makes a provider probably practice better care because your patients are going to get closer and be more comfortable. So certainly is one of the biggest points as a provider somebody needs to pay attention to.
Mm-hmm. Yeah. And what have you found a certain pet peeve? Like when you're a patient talking to a provider, like is it aggravating when people, ask where you're from?
Sorry, yes, it is. It's just when you first walk in, if a provider asks you where you're from, yes, it's a normal question. People would like to know that, and I'm more than happy to say it. But just when they go into details and they know, like, you may be struggling with your language and they just they don't feel confident because you have certain accent or they just want to know where you're from just to make fun of you. That's just not right. And it works as a patient and as a healthcare provider. I'm myself a healthcare provider working in the healthcare field. Just knowing that your coworkers don't accept you because you have a certain accent doesn't mean that you know less. It just means that things are a little harder. But it's just I don't know. I personally don't know like that.
Mm-hmm.
And then also, if I say I'm from Colombia and the first thing they're gonna mention is about drug words, it's like it's not a conversation that you do with somebody you don't know, unless it's related to what your problems history, your medical history is, or your mental history. Then I get it. But if it's not related, what is the point of making this sort of comparisons? It's just hurtful.
Yeah.
It's like if you're from Boston and people tell you, "Oh, Whitey Bulger," like people are not proud of that.
Right.
Why would you want to talk about it?
Right. And so I also read that in the Hispanic culture that a big show of respect is giving gifts.
So yeah, Hispanics have a tendency of giving thanks by giving a gift. So if you are very thankful for the help healthcare provider gave you, it's just as a respect, they will give you flowers, that they will give you, a sort of food that they are making just to be thankful, just to present something to them, to the provider.
And do you think it would be offensive for the provider not to accept the gift of thanks?
A lot of times it is. I mean, people put their thought and financially they may not be in a great condition, and they just want to be show their respect and know that they're thankful. And for Hispanic communities, it's hard to just say thank you. Just like verbally doesn't mean much unless you actually do something. So doesn't matter if people are really struggling or they're very poor, just like a little flowers. People just do whatever they can just to make that person feel special because they did everything they could for them. So just being appreciative and thankful.
And then the last thing that I found in my research was that family is very important, and that it might be important for providers to incorporate family into the discussion with the patient about what's best for their health care.
Well, I think that is true, but you also have to be careful. I mean, like in every culture, there is always the exception to the rule. But when this comes, you have to be careful about privacy. But in general, yes. I mean, if somebody wants the family to be in there, you, as a provider, you need to make sure you ask the family if they wanted them to be present. If they do, just, you give privacy and confidentiality agreements, and you let them know that whatever is going to be talked is sensitive or whatever it is. If the patient decides that's what they want to be, the provider should be comfortable with that because that's what the patient likes. So family is a big thing.
Okay, well, that's the few big things that I found in my research. So thank you so much for letting me interview you.
Oh, it was my pleasure.